Welcome to the COMC Community Spotlight Show. Of course, it's presented by the great folks at Central Ozarks Medical Center, where your health is their mission. And we happen to have one of those great folks from COMC with us here today. It's Morgan McClure. Thank you for coming in. Appreciate it.
Thank you for having me today.
All the way from Richland, right?
Yes, sir.
One of the many places COMC is found. So you are the manager. You got a big, long title.
I do.
Right?
Yes.
I don't know. It probably doesn't even fit on your desk. It's the manager of population, health, and network development.
Yes, sir.
What exactly is all of that? What do you do?
So I have a lot of outreach in the community. I work a lot with our community partners, but I also deal a lot with like reporting and the data on the back end. So I'm not patient-centered. I work a lot with data on the back end
Okay, so you kind of try to accumulate the numbers and the facts and what's going on and put them all together so that everybody kind of knows what's happening.
Yes,
all right.
sir. Yep.
Do you enjoy that? You like to crunch the numbers?
I do, yes.
Okay, all right. There are people that like that, I guess. You're actually from Tennessee. You grew up in Tennessee, right?
I did, yes, sir. Yeah.
How in the world did you make it to the lake?
So we made it over here. We made the move about 3 years ago. My husband has a family farm over this way, so we just made the journey and traveled to Missouri.
Do you like it? Do you miss Tennessee? How's that working?
I do. I like it a lot here in Missouri. It's a lot different than Tennessee. It's a lot slower pace, laid back. But yeah, it's a lot different, but I do enjoy it a lot.
Right,
yes.
yeah, it's so beautiful. But then again, so is Tennessee.
Tennessee is really beautiful, the mountains, yes.
Yeah, and I hear you're a sports fan.
Oh, I love
So is that
sports.
like you're
Yeah.
a big Volunteers fan?
Oh, absolutely, yes.
Really? How does
Yes,
that
sir.
work when Mizzou plays Tennessee?
Well, we always root for Tennessee, of course.
All right, so you've converted the husband and
Yes,
everything, huh?
you sure have, yeah.
Wow, there you go. All right, so, and they're even in the same conference now.
They are,
So
yeah.
they get to see each other every year. Okay, so this is the time of year. It is past us this year already, just a few weeks ago. But we celebrate National Health Center Week this time of the year. What is that? What is National Health Center Week?
So National Health Center Week is the first week, happens in August of every year. So it's where we can give back to our community and thank them for what all we do, because our community is very involved with us as well. So we have several days. It's through the 5-day week. So we've got staff appreciation on Monday. We obviously can't do anything without our staff.
Yeah.
So we have like t-shirts for them. They get goodies, things like that. We give them breakfast. We have Patient Appreciation Day. We have Stakeholder Appreciation Day, so we go to our stakeholders and give them little goodies, thank them for what they do and partnering with us.
Mm-hmm.
And then we also have our Laundry Love Fund event. So that is the day that we have been collecting funds, and we'll go to the local laundromat and help families do up to 4 loads of laundry that COMC will pay for.
Wow.
And then last but not least is Saturday, which is the KidPalooza event. It's held in Camdenton from 11 to 2. We'll have food trucks. We'll have bounce houses for the kiddos, kind of like Touch a Truck with, we've got ambulances and fire trucks coming, lots of education and resources, and then we also have giveaways as well. So it's a free event, 11 to 2, and everybody is welcome.
You know, there seems to be, COMC tends to do, it seems like anyway, a really good job interacting with the community and doing events like that. There's several events throughout the year that COMC kind of tries to reach out, touch the community, and let the community see them and how they work and everything.
Right, absolutely, yes.
Yeah.
I feel like once a quarter at least we did, the run fun or the fun run. We do all kinds of events all of the time, I feel
Right.
like. Yes.
Yeah. And the people at COMC, if you're not familiar with them, I mean, I don't know that I've ever met somebody from COMC that wasn't just a really nice, kind-hearted person that would go out of their way to help you. I'm sure there's some there, but I haven't met them yet. You know, it's pretty stunning how many good people tend to gravitate towards COMC.
Absolutely. That is a very nice compliment. We do appreciate that.
Yeah,
Yes.
yeah. And so COMC is kind of spread out across central Missouri.
Mm-hmm.
So you're in the Richland office, but you kind of make your way all around.
Yes.
Osage Beach.
Osage Beach.
There's, I think, a couple of places in Osage Beach,
Yeah,
right?
so we've got Hy-Vee now, the old Boone Clinic. We just got that one. We've got Dental, Medical, and BH there in Camdenton with our new expansion.
Yep.
And then we've got here in Laurie as well, and then our school-based clinic in Eldon.
Right, and new place coming to Crocker?
Yes, Crocker's coming hopefully this fall, so that's another one.
I mean, growing a lot. It's pretty stunning with the new places, the new place in Osage Beach, the new place coming to Crocker, the expansion in Camdenton, just to give you an idea of how fast things have been growing at COMC. So you've been with COMC for 3 years, and I think.
Yes.
And you've kind of had a couple of different jobs, a couple of different managerial jobs. Seems like there's a lot of room for growth with the way COMC is expanding.
Absolutely, yes. So I started out clinic manager, made my way to dental operations manager, and then now my position now. So, but yes, there's lots of room for growth, opportunity. If you start out as a receptionist, access coordinator, and want to go to dental, or you want to go to medical or BH, there's tons of opportunity for growth and improvement, whichever way you want to go.
That's pretty cool, because that doesn't happen everywhere.
Right,
You know,
yes.
somewhere you go and you're kind of stuck there forever. But here you have a chance to move up, move around. Which job that you have done in your 3 years at COMC have you enjoyed the most? I mean, it's like, I'm thinking dental. I don't know that I would enjoy dental, but did you enjoy that?
I did enjoy dental a lot. Yeah, there was a lot of travel involved, which was nice. I like to travel. But also I really like where I'm at right now too. Doing a lot of data and numbers, making sure that everything lines up with our funding and everything like that. Because even though I'm not still patient direct, I still see that we are helping patients and running those numbers like, wow, we've seen this many patients in this time frame. Like, that is amazing.
Yeah, that is amazing. Okay,
Yes.
so it's Morgan McClure. She is the Manager of Population Health and Network Development. We'll continue to talk about all this and the amazing things happening at COMC when we come back on your COMC Community Spotlight Show. At COMC, your health is our mission. Central Ozarks Medical Center offers 3 OBGYNs at the Osage Beach Clinic and 2 pediatricians with same-day appointments available. At COMC, our doors are open to everyone with 5 primary care locations conveniently located across the Ozarks. COMC for the best medical, dental, and behavioral health care. Get more info on how COMC can help you at centralozarks.org. COMC, where your health is our mission. Welcome back to the COMC Community Spotlight Show. We're talking with Morgan McClure, manager of just about everything, it seems like, over there at COMC, Population Health and Network Development. So in your job, I would guess you would kind of have to have the personality where you like to help people. Is that true?
Absolutely, yes, sir. Yep.
Okay.
I enjoy helping others. If it's professionally, personally, however I can help them grow, I would love to do so. Yes.
Okay. So that comes in handy when you're in healthcare.
Yes.
And I was reading your bio. It seemed like you knew you wanted to be in healthcare from a really early age. I think you had your nursing degree in high school. Did I read that right?
Yeah, so my high school offered a certified nursing program in high school. So I graduated high school with my CNA license.
Yeah.
So I had started working at the hospital whenever I graduated that summer. And I'd worked there for about 3 or 4 years. And then I realized, nursing wasn't the exact path I wanted to take, which was fine. I still wanted to be in healthcare though. So I transitioned to a receptionist role at an urgent care. And then that's how I kind of got into management. I just worked my way up, front desk, and then front desk coordinator, and then office manager. And then I enjoyed that because I was helping people.
Right.
And
but you knew you wanted to be in healthcare.
Yes.
So you found out you didn't necessarily like the nursing part of it. That's a hard job.
It was very hard.
Wow.
Yes.
And you got to you put up with a lot of stuff when you're a nurse.
Yeah.
Right. I've got some family members that are nurses, and they tell me some stories. It's like, whew, I think I'll stick to talking for a living, right? But that's cool that you knew you wanted to be in healthcare from that young of an age. And then in college, you graduate East Tennessee, right? Okay, which
Yes, sir.
has a great baseball program from
They
what
do,
I hear.
yeah.
But you graduate with something called exercise science. I've never heard of that before.
Yeah, so exercise science and kinesiology, they kind of go hand in hand. So it's kind of like I could go into physical therapy, I could go into occupational therapy, I could do physical education like a PE teacher if I wanted to, because I love sports and I knew I wanted to help people. So kind of just combining the two together.
That works?
Yes, it did. But I was already in healthcare, so I was like, I'm just going to stick it out, get my toes wet. And I stayed in healthcare. I haven't transitioned and used my degree at all.
Yeah. So. Obviously, I know nothing about exercise science because I seem to get bigger as the days go by. You know, you're also a twin,
I
right?
am. Yes,
And
sir,
is it a twin sister or twin brother?
Twin sister.
Sister. So are you guys like? Do you have that ESP going on where you can read each other's minds? Or
when we were little, I say we did, but we've been apart for quite some time now, so I'd say it gets harder.
Yeah. Is that hard? Is it kind of like losing a piece of yourself?
It is very difficult being away from my sister. Yeah. But we have trips. You know, we go every few months to see each other, meet halfway. However we can make it work. Talk on the phone every single day.
Do you?
So.
And so you get your little twin fix
we
going
get our
there.
time in.
I've actually got cousins that are identical twins, and their wives. I've talked to their wives about it. They have to get together, like at least every week, or they go weird.
Yeah,
right?
it's very difficult. It is.
Yeah, that's kind of strange. That's funky. I've always wondered how that would be. And they're back in Tennessee, right?
They are.
So do they like coming out to Missouri? You like going back to Tennessee? How does that work?
Yeah, we do it both ways. They've came out just a couple of times. It is harder because they do have littles. And it's a 12-hour trip, so it is hard. So most of the time, I just travel back to Tennessee when it's just myself.
You got a little now too.
I do have a little now.
What a cute little one you got there.
Yes.
Okay, so you touched on it a little bit earlier, but a couple of the community things that COMC does, this KidPalooza thing, and that's kind of a way that you touch the community and kids, and I'm guessing to help them understand the importance of medical care and all of that, right?
And dental, yes.
And dental care,
Yes.
right? Which is huge. I mean, and some families don't make that an important thing, and it is.
Right, yes. Everything starts, with your dental health. If your dental health is bad, it affects everything else. So your medical, and then, your medical goes to your BH. So it's all linked in together. So we have to take care of our body as a whole.
BH is behavioral health.
Behavioral health, yes, sir.
All that plays together.
It does.
And you were in dentistry for a while. Tips for good dental health. Brushing your teeth every day, I'm guessing, twice a day or
yes, brush
more?
your teeth twice a day at least.
Right.
If you can do it 3 times a day after lunch, that's even better. Make sure you're flossing, using your mouthwash every day, and then getting your cleanings every 6 months as directed, and then going from there. If you need additional treatment or follow-up, certainly get that done as well.
And you guys actually say your health care starts with the dental health care?
I would say it starts, yep.
Wow, that's pretty important. I've never really heard about that. Okay, and so that was the KidPalooza where you try to touch with the kids, and you mentioned the laundry thing earlier too, where you try to help do laundry for community members?
Yes, so the Laundry Love Fund event is a part of National Health Center Week.
Okay.
So I believe it happens on Thursday, and we have collected, or we are fundraising currently, money at all of our clinics. And then also we are partnering with some local coffee shops for some funds as well. I will collect those, and then they will be dispersed to our CHWs. And our CHWs will go to local laundromats that we have identified. And then patients or community members can go do up to 4 loads of laundry per family.
Wow, that's pretty cool.
Yes.
CHWs are community health workers,
yes,
right?
Sir. Yep.
See, I'm starting to learn
You're
all this
getting it.
lingo
You're getting
from
it.
COMC. Okay, we're down to less than a minute, but real quick, you're a big sports fan. What was your
Absolutely.
sports?
Oh, absolutely. Volunteer football. Tennessee football is number 1.
Okay. Did you play any? Did you?
We played softball, volleyball, and basketball when we were growing up.
You're doing all that. All right.
Yeah.
I'm guessing you were tough. You'd probably come in spikes up, huh?
Oh, yeah. You
Okay,
bet.
there you go. So it's Morgan McClure, big long title, Manager of Population Health and Network Development. Thank you so much for coming by
Yes,
and
sir. Thank you
kind
for
of
having me. I appreciate
letting
it.
us know more. It's so easy, isn't it? Okay, before you go, if folks want to get more information on COMC, how do they do that?
Absolutely. So you can check our website. If you see anybody with a COMC shirt, out in the community, just chat them up, and they can be able to direct you to the right way.
Okay, and the website is centralozarks.org.
Yep.
Okay.
Yes, sir.
Thank you. And thank you for joining us for the COMC Community Spotlight Show.